What is insomnia? Insomnia is a common sleep disorder when you experience disruptions in how you feel or function because you aren't sleeping well or sleeping enough. It can make it hard for you to sleep and stay asleep, or even cause you to wake up and not be able to get back to sleep. It also affects your daily life when your energy is drained from the sleep you don't get enough. The condition can be short term, acute, or can last a long time, chronic. It may also come and go. Acute insomnia lasts from one night to a few weeks. Insomnia is chronic when it happens at least 3 nights a week or 3 months or more. How many people suffer from insomnia? Over 237 million people across the world struggle with insomnia, with nearly 30% of the Thai population, or up to 19 million, suffered, mostly for a short period. About 10% of these people suffered chronic insomnia with some conditions lasting for months. So, what causes insomnia? The average person could have 1 to 2 sleepless nights per week, but it would become a problem when the condition persists every night for more than 2 weeks. Sleep-deprived people still lack a good understanding of insomnia, hence they were focusing on the symptom more than the cause, which are stress, irregular sleep schedules, lifestyle, mental health disorders, physical illness and pain, medications, neurological problems, specific sleep disorders, age, and pregnancy.
There are two types of insomnia. First, short-term insomnia, also known as acute or adjustment insomnia, is a temporary sleep disorder often triggered by stressful life events such as medical diagnosis, pandemic, drug withdrawal, or major life changes. This type of insomnia typically lasts less than 3 months and may resolve as the individual adjusts to the stressor. However, it can sometimes persist and develop into chronic insomnia. Second is a chronic insomnia. Chronic insomnia is a long-term sleep disorder characterized by difficulty falling or staying asleep at least 3 times per week for 3 months or more. It may stem from various causes, including persistent stress, irregular sleep pattern, poor sleep, and physical or neurological conditions. Unlike short-term insomnia, which is chronic, insomnia may be ongoing or have recurrent episodes over time. Why the sleep disorder of insomnia is principally classified as either short-term or chronic. There are other terms that may be used to describe insomnia. Let's start with sleep onset insomnia. Sleep onset insomnia is a difficulty falling asleep at the start of the night or when trying to sleep during irregular hours. This leads to reduced total sleep time and daytime effect from lack of sleep. And we gotta move on to the sleep maintenance insomnia. Sleep maintenance insomnia is a trouble staying asleep throughout the night, typically involving waking up at least once and struggling to return to sleep. This results in fragmented sleep and increased by daytime drowsiness. And next is terminal insomnia. The symptom is waking up too early and being unable to fall back asleep, often more intense wake up time. This can lead to a cycle of daytime sleepiness and disrupted sleep patterns. And the last is mixed insomnia, which is not a formally recognized type. It's a combination of issues related to sleep onset, maintenance, and early morning awakening. Insomnia patients they might have symptoms like trouble falling asleep, difficulty staying asleep, unwanted early morning waking, resisting bedtime, and difficulty sleeping with our caregiver, which is happen more common in children and teens. And daytime symptom is fatigue and sleepiness, impair attention or memory, reduce performance at work, school or social activities, increases risk of accident, and behavioral effects like hyperactivity or aggression, especially in children.
This is how to sleep with science. Some people would say that you're simply not working hard enough to sleep. But is it really that simple? Why do we need all these procedures to just sleep? Why is curing insomnia so hard yet the fix seems so simple? Just sleep, right? Occasionally, something happens in life that disrupts sleep for a bit, and it's acute, but it settles. You move house, your dog dies, it's Christmas, you're working on a presentation, and look, it's a normal response at one level to be a little on edge and not to sleep as well. But let's hear it from sleep experts and actual insomniacs who would really understand when this is not normal and really becomes a problem. I'm going to start off with how doctors would diagnose you. A physical exam would be done if the cause of your insomnia is not yet identified. Your healthcare professional may do a physical exam to look for any medical problems that may be related to insomnia. Blood tests could also be conducted to check for thyroid problems or conditions that may be related to poor sleep. A review of your sleep habits as an addition to asking questions about your sleep. This review could be conducted by completing a questionnaire to show your sleep-wake pattern and your level of daytime sleepiness, and you may also be asked to keep a sleep diary for a couple of weeks. If the cause of your insomnia is not yet clear, or you have signs of another sleep disorder such as sleep apnea or restless leg syndrome, a sleep study would be required. This includes spending the night at a sleep center, where tests are done to keep track and record various body activities while you sleep, like brain waves, breathing, heartbeat, movements, and body movements. Turning to my main point, the first line recommended treatment for insomnia is CBTI, Cognitive Behavioral Therapy for Insomnia. That's what it stands for. The purpose of cognitive behavioral therapy is to help control or stop negative thoughts and actions that keep you awake. It's a sort of sleep therapy, which can be held face-to-face or online, that teaches you to learn and change beliefs that affect your sleep. For example, ending the cycle of worrying so much about getting sleep that you cannot fall asleep. It is ironic, yes, but despite it being simple, this does not mean it's easy. CBTI is in fact so powerful that it is the first line recommended treatment for insomnia, and it allows you to regain your confidence in your ability to sleep well, even after you stop working with your therapist. This drug-free method is just as effective as sleeping pills, and not only in the short term, but long term too, along with no negative side effects, unlike sleeping pills. Let's return to the main solution offered. First, stimulus control therapy. This trains mind and body to not fight sleep. For example, setting regular times to go to bed and wake up, not nap, and using the bed only for sleep. The point is to only use your bed when you're sleepy. Second, sleep restriction involves avoiding time spent in bed during the day and more at night. Third, remaining passively awake to reduce your worry and anxiety about being able to get to sleep. using reverse psychology, trying to stay awake rather than expect to fall asleep, reducing extreme focus on sleep and anxiety, making it easier to fall asleep. Lastly, if you fall asleep too early and wake up too early, you can go outside when it's light out to push back your internal clock or use a light box. However, another method would be to take prescription sleeping pills. Prescription sleeping pills can get you to sleep, stay asleep, or both. Relying on them for more than a few weeks would make them less effective, along with increasing risk of other side effects like poor memory, brain degeneration, depression, etc. Ultimately, it makes insomnia worse. The one thing I want you to take away from this presentation is that this is a serious condition and can affect everything in your life, including your behavior, health, relationships, and of course your mind. Go get consulted to first identify what is actually and really the cause of your insomnia so you can help yourself and or find someone to help you. That is